All right, everyone, we are going to get started for the sake of time. So first of all, I wanted to thank all of you for taking time out of your very busy days to join us today. Today, we are going to be discussing remote methods as part of the HOPWA Office Hours series. In particular, we're going to be focusing on remote methods when it comes to intake, initial and annual certifications, as well as virtual inspections. Next slide. So we're going to do some introductions. For those of you who I've never met before, my name is Steve Ellis. I am a senior analyst with the Cloudburst Group. I know many of you through the HOPWA technical assistance that we do, either through the CARES Act or through modernization, as well as the CAPER and APR validation process. So thank you again for joining. Heather, would you like to introduce yourself?
Hi, everybody. My name is Heather Rhoda. I also work at the Cloudburst Group and do quite a bit of work with HOPWA grantees and their project sponsors. Also do some work with the APR and CAPERS and provide quite a bit of HOPWA related TA. I'm glad everybody could join. Thank you.
And we'll go to OHH.
Hi, I'm Rita Harcrow. I'm the director of the Office of HIV/AIDS Housing, and appreciate everyone joining today. And to our friends at Cloudburst, thanks for pulling all this great information together. I hope we can answer a lot of questions today. Amy?
And I'm Amy Paulonis. I'm a senior program specialist in the Office of HIV/AIDS Housing, and I'm looking forward to taking your questions today.
Thank you, everyone. You'll see our faces again later on when we get to some of the questions. Next slide. So as we get started, before we go into details, we just want to give you some general information. So our goal, our objective today is to provide you an overview and a reminder about a few HOPWA program requirements, to refresh you on some of the HOPWA waiver flexibilities that have been issued due to the pandemic and COVID-19. And then finally, we're going to get to and answer some of your burning questions about conducting virtual inspections and completing initial, interim, and annual certifications remotely. Next slide. So for those of you who like an agenda, here's what we're going to be looking at during our 90 minutes. So we'll start with those general HOPWA eligibility requirements, and then we'll go into specifically the waivers and flexibilities for those requirements, particularly around HIV status and income and how to document those. We'll then pivot to HOPWA habitability and HQS inspection requirements and what waivers and flexibilities were put out regarding that topic. We'll then go to your questions and answers. So as we are going through, if you do have any questions, please throw them into the questions box so that we can ask them when we get to that moment. We most likely will not get to everyone's questions today. So as always, if we're not able to get to your question online, we'll definitely handle it offline. And we will also try to share a list of the questions and answers for everyone. So that will eventually be posted to the HUD Exchange. And finally, we'll end today's office hours with some resources and reminders as well as where to find help if you need more information or assistance as you move forward after today's office hours. With that, I'm going to turn it over to Heather.
Hello, everybody. Again, thank you for joining today's office hours. As Steve mentioned, we're going to first start with just some refreshers, and then we'll move into specific information. Next slide, please. So we're going to be starting with, as I'm sure everybody knows on this call, just a reminder about the HOPWA eligibility requirements, right? HOPWA eligibility requirements apply to all activities except for housing information services, and those being at least one family member must be diagnosed with HIV/AIDS. This may include a minor, and total income of all family members must be at or below 80% of the area median income. This information, area median income, income level of the entire family, must be verified initially and at least annually thereafter. Next slide. So regarding verification of HIV, in general, I wanted to talk a little bit about some key elements associated with HIV verification, because we've had a few questions about it. HIV only needs to be verified once, right? And physical documentation must be in the current household file. And the form of HIV verification needs to be legible and meaningful to a non-medical professional. And as you might know, and if we haven't told you already, you can follow along the presentation live right here, but you can also click on handouts where we have a PDF version of the slides from the office hours, including some additional notes for each slide. Let's move to the next slide, please. So what are the HOPWA income verification requirements? Remember, this is just in general. So in general, except for housing information services, all family income and assets, unless excluded, that is received by or on behalf of any adult family member, including minors, must be verified before assistance is provided. The same income and assets from all family members, including minors, must also be verified at least annually. In addition, any income source, that being, assets included, that changes during the year should also be verified at the time of the change, which we refer to as an interim recertification. This is especially important when somebody is receiving HOPWA rental assistance, because that income change, particularly if it's a reduction, could change the assisted household's portion of rent and therefore lower the portion that they are required to pay. Next slide, please. So knowing what the general eligibility requirements are for income and HIV verification and attempting to gather those types of documentation and verification in the middle of a pandemic, are there waivers available regarding getting that type of documentation? And yes, I'm sure you're all aware that there are waivers covering this. One of which is an HIV/AIDS diagnosis can be verified via other credible information, which includes self-certification, and income of all family members can also be verified using self-certification. Next slide, please. But first, to be able to verify using other credible information or self-certification, if you're a project sponsor, your grantee must have notified HUD of their intent to use the waivers. And then as a project sponsor, you need to be in open communication with your grantee about your intent to apply any potential waivers that they've notified, that your grantee has notified HUD about. Next slide. So how do the waivers affect your current intake in like for initial and annual and income recertification process? Everybody has a process, right, for which they've established that they've been using, pre-pandemic. And the waivers don't mean you need to throw out your process entirely. What the waivers do is make it a little bit easier and quicker to determine eligibility and to begin providing most necessary services, whether it be supportive services and housing assistance, before obtaining physical or source documentation of HIV/AIDS status and income eligibility, income verification for the household. So the waivers are meant to complement your current eligibility determination process. Next slide, please. So regarding the HIV waiver, verification waiver, what does that mean? Well, you still should, to the extent that you're able to, obtain source documentation if possible, right? So as part of your intake process, that would include asking if, a client or potential household, the person who's HIV positive, has any documentation on hand, right? Or maybe you could obtain HIV verification rather quickly through like a testing center or a medical facility. In addition, if you're going to be using the waivers, both grantee and project sponsor policies and procedures should be updated to include that you're going to be using other credible information, including self-certification, to verify HIV status when source documentation can't be obtained. In addition, you must then obtain source documentation within 3 months after safety measures within your community are no longer needed. Next slide, please. What are some examples of other credible information to verify HIV status? Well, as part of your intake, you could be working with a potential client and do a review of their HIV medications. You could discuss with them a doctor that they might be seeing or in treatment with, their own knowledge of their own viral suppression, and also self-certification of their own HIV status and HIV medical history. Another option is you could get a referral from another HIV-specific agency that might have been providing non-HOPWA type services to the person that you're conducting an intake with. Also, you may be able to get some information or acknowledgement from a case manager within your same agency who may have been providing case management or already been working with the client and knows them to be HIV positive. Next slide, please. What does the waiver mean regarding income verification? Well, self-certification of income can be used in lieu of source documentation, including, third party. So this means in lieu of, Social Security benefit letters, paycheck stubs, items like that. This applies to any activity in which documentation of income is a factor or is needed, right? So you're looking at intake, conducting intake, and overall HOPWA program eligibility, except for housing information services. And as part of determining income and calculating portions of rent for tenant-based rental assistance, master leased units, and facility-based housing, both permanent and transitional. And it also applies to when you're working with existing clients and you're conducting an annual or interim recertification. Please also note that although you can use self-certification, you should continue to try to collect source documentation for household income whenever it's possible. Next slide, please. Now, this is where Steve is going to pick up, and he's going to talk a little bit about HOPWA habitability inspections.
Thank you, Heather. As you are all aware, that there are some inspection requirements for the HOPWA program. So all units assisted with HOPWA rental assistance must pass habitability or HQS. Make sure whether or not your community uses habitability or HQS is outlined in your policies and procedures and uniformly applied across your area. So particular note, these units must pass the inspection at initial before any HOPWA assistance is provided, and at least annually. Next slide. As part of any inspection requirement, there's also a requirement to be aware of lead-based paint. Particularly anyone who might be doing a habitability needs to be aware of lead-based paint visual assessment requirements. So as part of HUD programs, there are times when a unit will need to make sure that it passes this visual assessment. So particularly for the HOPWA program, when it comes to HOPWA TBRA, master leasing, and facility-based housing, you need to be aware and do a lead-based paint visual assessment for any unit that's built before 1978, where a pregnant person or in which a children under the age of 6 will reside. These lead-based paint visual assessment requirements will also apply to HOPWA STRMU, but only in which where a unit which STRMU will be used for over 100 consecutive days, assuming once again that the unit is built before 1978 and that unit's going to have a household that has a pregnant person or children under the age of 6 living there. Next slide. So, are there waivers available regarding this? And of course there are. So the first waiver, April 1st, extended some property standards to TBRA. The second waiver, put out May 22nd, applied these property standard waivers to all HOPWA activities that required an inspection. So these waivers gave programs the flexibility to say that all initial habitability and HQS inspections can be done virtually. It means that inspection still needs to occur at initial before any assistance is provided, but it does not have to be done in person. And as a quick reminder, that grantees do need to notify HUD of their intent to use this waiver before they start applying it to their program. Next slide. So let's talk about how to take these waivers and apply it to your current inspection process. Because if you are utilizing any of those HOPWA activities that were an inspections required, you already have something and have been doing something for years, and it's probably operating fairly well. So what these waivers mean is that you do not need to throw your entire inspection process out of the window and start from scratch. What this means is you now have the ability to do virtual inspections if physical in-person inspections are not possible or not safe. So basically, this is just going to complement what you're currently doing, right? Because there might be situations where initial inspections can be done so in person, right? You know, physical face-to-face, particularly if it's an empty unit. So it doesn't mean you have to automatically do initial inspections remotely, but it is an option to make sure that everyone stays safe during the pandemic. Next slide. So what this all means is that your initial lease-up inspection, that these inspections must continue before assistance is provided, but they can just be conducted using remote technology. So when we talk about remote technology and virtual methods, we're talking about things such as live streaming, pre-recorded videos, or photographs. For those of you who are able to join us in the past, there was a webinar on doing remote inspections virtually. We can make sure that when we are done, we share that link with everyone in case you have any questions about how to do so. But in the meantime, if you do need to look it up, it is posted on the HUD Exchange, not just the slides, but also some examples on how you can do your inspections remotely, particularly using live streaming and pre-recorded videos. As always, it's worth noting that if you are going to do or need to do initial remote inspections, to make sure to update your policies and procedures, particularly that there is a requirement that in-person on-site inspections must be done once it's safe to do so. So you'll need to make sure that not only are your policies updated, but you're tracking the units where these inspections need to occur once the public health emergency is lifted. Next slide. So far we've been talking about initial inspections, and now we're going to bring in this idea of annual inspections. So we've seen a lot of questions in the past about if there are waivers available for annual inspections. And so there are no, per se, waivers about annual inspections, but there have been a number of waivers, or sorry, flexibilities that have been put into place to help you with annual inspections. So annual in-person on-site inspections can be postponed or done virtually. If you're already doing your initial inspections virtually, you can now also do your annual inspections virtually. If this is what you're going to do or any changes that you're going to make, please make sure to update your policies and procedures accordingly. And if for some reason you aren't going to be doing in-person or virtual inspections, HUD does expect HOPWA program staff to at least check in with clients about their conditions of their unit. So make sure to have some sort of phone call that you're asking about, is it safe? Is it livable? Maybe you're running through the questions that you normally run through when you do an in-person inspection. Maybe you're adding a few additional questions. Since you're not able to see the unit, you're not able to touch things in the unit, right? So just make sure that's all outlined in your policies and procedures. So you're not only staying safe and keeping your clients safe, but you're also meeting the HUD requirements and HUD recommendations for doing these inspections. Next slide. And when it comes to waivers for lead-based paint visual assessments, right now there are no waivers saying that you do not have to do them. But you can also do them, like these inspections, virtually using live streaming or other methods. So in general, a lead-based paint visual assessment is going to be performed as part of any habitability or HQS inspection. So you can easily fold that into your virtual methods that you're conducting already. As always, make sure to update your policies and procedures to reflect any changes that you are making. There is a special note, particularly this would come into effect for annuals, but for any unit where lead-based paint visual assessment rules apply, a visual in-person physical inspection must occur once it's safe to do so. So this is going to be another instance of where you're going to need to track this to make sure that when the public health emergency is lifted, you're going in to not only do your initial inspections in person, but also any annual inspections where lead-based paint might be an issue. And it might be worth trying to prioritize those units where lead-based paint might be an issue. Next slide. All right. Those were our slides. And so in the meantime, let's get into some of the questions that have come through. So one of the first questions that has come through is people want to know, how do they figure out if their grantee has notified HUD of their community's intent to use these or any of the waivers? In these instances, if you're not aware if your grantee has notified HUD, please make sure to reach out to your grantee and ask. There's a clear path for how grantees should do this and how everything should be documented. So please do not implement any of these waivers until you are sure that your grantee has notified HUD. Another question, if a waiver is used, do we need to document the use of that waiver in the household file? The answer is yes. So please make sure if you are going to allow any of the self-certification or any of the virtual inspections, that there is a note somewhere in the file that you've applied this waiver. I think this is especially key if you need to follow back up with physical documentation. It's very clear to anyone who might monitor that file, not only of you using the waiver, but you doing your due diligence and following up. It will also be a good way to maybe explain why you might have a habitability or HQS inspection that might say at the top that it was done virtually, and then the exact same form might appear 2 months later when you did it in person. So please make sure to document this in the client file, this and any waivers that you might apply. Also tied to waivers, there's a question, do we need to track the waivers anywhere else besides the household file? So in general, tracking this anywhere else is not a HUD requirement, but it isn't a bad idea to go ahead and try to track the use of these waivers at a systems level, maybe on an Excel spreadsheet where you use client numbers. As you can tell for some of the information that we've shared and from some of the information for other webinars, there's required follow-up. So having a list in front of you of clients that might need HIV documentation for the file, having a list in front of you of what units might need to be inspected once it's safe to do so, will make your life much easier instead of necessarily having to go through each individual household file. I do know that there are some grantees that are requiring this additional layer of documentation, asking people to track it at a systems level. So please make sure to contact your grantee to see if there's any additional requirements besides the household file. Heather, are there any other questions?
Yes, there are. And I have a couple of questions for HUD staff. When do the waivers expire?
I can take that one. So there isn't a specific expiration date for the waiver regarding self-certification of income and credible information on HIV status. Grantees can utilize that waiver if they agree to obtain source documentation of HIV status and income eligibility within 3 months of public health officials determining that no additional special measures are necessary to prevent the spread of COVID-19. So that one is more open-ended and ongoing, and really has to do with how the pandemic plays out and recommendations on what safety practices are needed. For the habitability standards waivers that allow for virtual inspections, those are a little different in that there is a date tied to those. So those waivers are in effect for 1 year, beginning on the date of the waiver memorandums. So until March of 2021 for the first waiver memo that was specific to TBRA, and then May 2021 for the second waiver memo that was for all applicable housing types. So grantees can use those waivers if they are able to visually inspect now using technology and they have policies and procedures in place to physically inspect the unit after health officials determine special measures to prevent the spread of COVID-19 are no longer necessary. So I definitely just recommend that you reference the waiver memos that we published if you have questions at any point about the expiration of those waivers.
Great, thank you, Amy. And to follow up on that, on the waiver theme, when will the waivers be extended?
So that's a good question. So as I said, the documentation of income and HIV status waiver is pretty open-ended, just the way that it was written, and there really isn't an expiration date. So that one is really just based on how the pandemic plays out and what the recommendations are related to safety practices by public health officials. So that one is ongoing and there's not really a need to extend it at this point. As I said, the habitability standards waivers expire in the spring of 2021. There isn't really a plan right now or a need to extend those at this point, but we are constantly monitoring things and using any questions and concerns raised by grantees and project sponsors to inform our policy decisions. So we will absolutely keep you all updated if any waivers will be extended or any new waivers will be granted.
Great, thank you. I think that's all we have for right this minute. We do have a couple other questions that we have had grantees and project sponsors pose before. And are there any waivers for working with clients remotely? And I can definitely take this one. There's no requirement to work directly with clients face-to-face, so you don't need a waiver to work with clients remotely. The way in which case management is conducted and how you deliver, housing, HOPWA housing assistance such as STRMU, TBRA, PHP, how that's provided is at the discretion of the grantee, right? And according to their current policies. But what I can tell you is that current guidance in addressing the pandemic and making sure, you're keeping program staff safe and clients safe is that when you're providing HOPWA funded supportive services and housing assistance, those activities should be done remotely as much as possible. Another question that we've had before is, can we work remotely with clients that are new to our agency? And the answer to that is yes. HOPWA program staff can work with existing and new clients remotely. As I mentioned earlier, current HUD guidance is to provide HUD-funded supportive services and housing assistance remotely as much as possible during the pandemic. But if that's not possible to conduct those activities remotely and do need to be in person, all work, right, that you're doing should be conducted using protective health measures and considering precautions such as social distancing and wearing face masks. Steve, I think there are a couple other questions that you wanted to tackle.
Yeah. So some of the questions that we have seen come up are some more about physical signatures. So people want to know, are there any waivers regarding physical signatures? So first of all, it's worth noting that physical signatures are not a HOPWA requirement. So therefore, there is no waiver necessary for physical signatures. So if this is something that you do have as part of your policies and procedures, it is probably best to try to address this in some sort of safe method. And that might be, instead of physical signatures, doing signatures via telephone. Maybe that might be involving a witness. You might be able to get physical signatures for documentation via mail, sending things back and forth. But please make sure, as always, if you are changing any of your current processes, that you update your policies and procedures, particularly if you plan on reverting back to your usual process once it's safe to do so. Another way that people can get signatures, and a question that's come up, can programs use electronic signature software like DocuSign to get signatures? And if HUD has a preference for some type of electronic signature software. So first of all, it is totally allowable to use electronic signature software as an option to get those signatures for anything that you might have. So please make sure, if you're a project sponsor, you're consulting with your grantee before purchasing or utilizing any of this, once again, to make sure that everything is updated in your policies and procedures. This will definitely be something, because you'll be purchasing software. You're going to want to talk to your grantee about how to allocate those costs. The cost of purchasing any software is allowable under the HOPWA program and should be allocated similar to any of your other overhead costs, in that it should either go to the activity that you're going to use the software, or prorated across different activities, or maybe even different funding sources if any software might be used for multiple programs, say like HOPWA and Ryan White. HUD does not have a preference for any specific type of electronic signature software outside of any requirements that you probably already are aware of, like confidentiality and safety, right? So just to make sure any software that you might purchase is safe for clients to use, since most of the forms they're going to be signing will most likely have some sort of sensitive information on it, or some sort of information that can identify who the person is. If there is a particular software that a community, an EMSA, whatever your HOPWA grantee is, whether that's a city or a state, that should be covered in the policies and procedures as well. So once again, if you're a project sponsor, please consult with your grantee for specifics. Heather, what about some other questions?
Let me take a look and see what we have. We have received some questions regarding the waivers in general, specifically allowing self-certification of HIV and/or income. And one of them being, are programs required to automatically allow people to self-certify HIV and income? The short answer to that is no. The waiver doesn't mean you're required to automatically allow for that, but ultimately that's up to the grantee first if they even choose to utilize the waiver and notify HUD of their intent to do so. So you should, when you're working with a client, you're doing intake, to have a discussion about the availability, right, of the source documentation, because it's possible. And we have spoken to, several grantees and project sponsors that have been able to obtain, source documentation of HIV status and income pretty quickly. In some cases, the applicants or existing clients, especially if you're doing like an annual recertification or an interim, they have that information on hand. So definitely ask. And at the point that you have asked and explored, if that information isn't available, the waiver is there to allow you to, quickly provide assistance and quickly and easily process your annual recertifications. Just be aware, though, if waivers are being used, grantees must have included this in their updated policies and procedures, and also notified their project sponsors about the availability of those waivers. So project sponsors should be checking in and confirming with their grantee about what and if any waivers are available and when they intend to use them. Another question. Oh, go ahead.
This is, I just wanted to weigh in on that one too. And just remind everybody that the purpose of the waivers is to give you flexibility, to give the grantees flexibility in managing everything that we're all dealing with the pandemic. And the thing that you should have as your number one priority there is what's safe for your staff and for your clients that you serve. So maybe you can conduct business safely and get documentation safely without utilizing these waivers. So just always remember that should be the priority one, is what is going to keep people from sharing a breath. Thanks.
Thank you. If a client self-certifies HIV diagnosis and income, is physical documentation of both needed for the file? Yes. As Amy mentioned earlier on, the grantee and project sponsor must obtain source documentation of HIV status and income within 3 months of public health officials determining that no additional special measures are necessary to prevent the spread of COVID-19.
And Heather, I just want to add real quick, because I think there's some questions about that, right? The public health emergency really is locally defined, right? Because the way that this disease is spreading and the pandemic's occurring is it's really impossible for a federal program to explain this for everyone. So if you're a project sponsor, please make sure to contact with your grantee about when this documentation or any follow-up might need to occur, right? So all of these deadlines about 3 months. As a grantee, we would definitely recommend reach out to the public health department for your particular area and find out from them, right, if there is a public health emergency already documented, and if there's not, is it safe to do so? Because a lot of this is going to come down to how the grantees define public health emergency, and that's when that clock's going to start ticking. So for anyone asking about when that clock ticks, please make sure to contact your grantee.
Right. And also too, if you might remember from talking about verification, you might remember from a remote methods presentation we had done, Steve, if you want to hop back on the camera, that we had done a while back, where we were sort of role playing. Remember when we were role playing a program and a client, and that individual was working, right, and had paycheck stubs, and they had medical documentation, and was showing those virtually to the program staff, right? And in that sense, that where you could even take a screenshot of that and print that, that's documentation of income, right? So grantees and project sponsors can be creative about the ways in which, they've been obtaining source documentation, including absolutely, obtaining self-certification of both, when those items aren't available. But the point is that you have a lot of flexibility, which is great.
Of course.
Let me see, any other questions that we have coming in through the question box that we want to address?
I think some things worth addressing is people are asking if a client can self-certify income for other family members. So in general, right, you already had your own process. You had what you've been doing for your HOPWA program for a while. So usually you're probably asking each adult household member to provide source documentation of whatever income source they might have, their income, their assets, all of that. So in general, you can apply much of that to any virtual method, right? So if for some reason an additional household member can't provide the source documentation, or the source documentation might take a period of time to get, you can definitely ask additional household members to verify that income. However, if there are situations or scenarios where that's not possible or it's not timely, a client can self-certify income for others in their household. In the same way, maybe that HIV positive individual might have been declaring income for minors in the past, right? So it's just something to sort of take a look at what your current process is, what might still be reasonable, and adapting that with these flexibilities to make sure you aren't totally changing your process, but you're also not delaying giving assistance to people who might need it because of a technicality such as requiring source documentation.
Right. And while at the same time, you're keeping program staff and clients safe and not requiring people to go out to, obtain, documentation, and it taking, a long time to get that information before you can give them assistance. Do you want to move? Oh, go ahead. Do you want to move on to some of the inspection questions? Because we have quite a few that are rolling in. And
Yep.
it seems to be specifically related to doing an inspection and lead-based paint visual assessment as it pertains to an overall habitability inspection for something like TBRA versus what you need to do and when for STRMU.
Yeah, so as we had talked about, so the habitability requirements, whether or not you use habitability or HQS, apply to HOPWA rental assistance programs as we outlined. So for STRMU, there is no requirement that a unit pass habitability or HQS. It's generally good practice as part of any STRMU process you might have to ask these questions, right? To make sure it's generally safe, it's generally livable, right? Some of the same standards you might have tried to apply them, but it does not need to pass to get that assistance. As a matter of fact, there are programs that if there is something that needs to be repaired in a unit, they can work that into a housing care plan and work with the landlord to try to get that repaired before any STRMU assistance might be offered. But there's no requirement for that. However, Separate from the habitability or HQS are these lead-based paint issues, right? And so once again, lead-based paint becomes an issue when you're going to use HOPWA in a unit that was built before 1978 in a family where there's going to be a pregnant person or children under the age of 6 residing there, unless a landlord can prove that there's no lead-based paint. In those instances, you need to do a lead-based paint visual assessment. So many of you who are listening to this have done that before, right? Where you are looking at the outside of a building, the common areas of a building, as well as the unit, looking for chipping, peeling, cracking paint, or any issues that might occur in the near future where a child might be exposed to lead-based paint and possibly poisoned. So this lead-based paint visual assessment can be done remotely. As Heather had mentioned, this was something that we did as part of our remote inspections webinar that we walked through and were able to look at a unit and see where there might be chipping, cracking, peeling paint or dust. And so that component does apply to STRMU when you're going to use STRMU assistance for more than 100 consecutive days. So please make sure, particularly with the flexibilities with STRMU, that you can provide additional assistance, that you are tracking this closely. And even recommended if it is a situation or a family where there's the possibility of using STRMU for more than 100 consecutive days, to just go ahead and do the visual assessment. That way you don't have to worry or potentially stop or delay assistance while that is conducted. Anything to add, Heather?
Great. Do you want to get to some of the questions that we had beforehand that we received?
I say let's just sort of jump around because I think a lot of it's tied together. So Heather, do you want to talk about what to do if you do delay annual inspections and if they need to be done once it's safe to do so? Are you there, Heather? All right. So initial inspections do need to occur before you provide assistance, right? So that was something we had talked about and something that should be, that can be done virtually as part of the waivers and flexibilities. Annual inspections can be delayed or postponed, or can be done virtually. At this moment, right, you still want to make sure that any unit is safe and livable. So you should have a plan to do any annual inspections once it's safe to do so if you're not doing it virtually.
Hi, sorry.
Hi.
I'm
This
like little.
This is perfect. We'll tie this in a little bit about some of the hazards of working remotely.
So go ahead.
No. So is there anything that you just wanted to add about the importance of doing annual inspections if you do delay them?
No. If you are delaying annual inspections, I think it's definitely important as part of like your annual recertification process, right? Because generally when you're doing like an annual recertification of income and the inspection, those things are lined up right together. So you're not doing an inspection completely separate, months later from the recertification process. So if you're working with clients remotely during an annual recertification, you're on the phone talking to them, you can include as part of your annual recertification, ask some questions about the condition of the unit, right? Has anything changed since the last annual inspection, right? Or is this the first annual after somebody's moved in? Has anything changed? Do your smoke detectors still work? Are you having, any problems with any of your large appliances? Are you noticing any, peeling, chipping, cracking paint, right? Do you have any broken window panes? Kind of, your regular, life and safety items that you might want to check on. So I think that's important to talk to your clients about and just document the file so you know that you've gathered that information.
Right, and speaking of documentation for the inspections, there's really not a difference in what you've been doing. So if you are doing a virtual inspection, you can use the exact same form that you have been using. There's no
Absolutely.
requirement to save any videos, to save any live stream, to save any pictures. Do what you've always done. That whatever form that you've been using is perfectly acceptable. If you are doing a virtual inspection and you come across something that is questionable or suspect and you do want to follow up when it's safe to do so, that might be worth saving a picture in the file just so you can remind yourself that you need to follow up. But so there's no additional documentation requirements for that. And so any additional documentation requirements for inspections would all be local, right? So I see there are questions about having people sign habitability forms if done virtually, like having the landlord and tenant sign it. If that's something that you choose to do, that is perfectly acceptable as a local requirement. But please make sure that this is through your grantee and they are aware that you are doing this, but that is not a HOPWA requirement.
Absolutely. Yep. Let me see. There's some other questions too. I think we clarified that when we were there, someone asked too because we tend to speak in acronyms sometimes, so we apologize for that. Asked what HQS meant, right? And so I just explained that it's housing quality standards. So HOPWA follows HOPWA habitability and, / housing quality standards, but then there's a separate like Section 8 housing quality standards. Some grantees and project sponsors use HOPWA habitability and the checklist that's available, on the HUD Exchange under, I think it's the HOPWA Administrator's Toolkit. There's also Section 8 housing quality standards inspections, which is a completely different form. And a lengthy form longer. And so either can be used. And I think generally overall, there's a mix between, grantees and project sponsors that, some use HOPWA habitability and some use HQS. But whatever one you're using, you should stick to that and, be consistent. Anything you want to add to that? It looks like we clarified the STRMU question Steve talked about. It's not that HQS or habitability is required specifically. It's that there's a point in time where, depending on, like you said, Steve, how many days STRMU is being provided, that it would trigger a lead-based paint visual assessment. But then that's only if the unit meets certain requirements itself, right? Did you talk about that? You did. The pre-78 and the, great.
Yep. And for anyone who's going to do the lead-based paint visual assessment, it is a required training. It's a 20-minute training through the HUD Exchange. So please make sure you're looking through that because it has some additional requirements or ways or situations that lead-based paint will not apply. So you just want to make sure that you're aware of all of those, and particularly to take that training so you're aware of what exactly a visual assessment is, but also what a visual assessment is not. So you're sticking to the scope and responsibilities of your job and knowing what you need to do if you find any potential issues.
Right. We have a question too about, is it necessary to do a consent form for each HOPWA application, or can we use one form for the entire year? I'm assuming this means like release of information consent, right? I mean, first of all, when you're doing an intake, right, you're going to want to have, anybody, any adult, right, in the household. If you're going to be seeking information from an outside party about somebody residing in the household, in addition to the client, then you need, to have them sign a consent form. And so consent forms, should be signed initially and then updated annually each year thereafter.
I want to note that there's a number of questions I'd like to ask, but I think there's some additional details that might be difficult. So as I said earlier, if we don't get to everyone's question, we will address them offline. So I apologize to some people. You're asking questions, and I think they're too complicated for a webinar or office hours and might require some back and forth. So I said, so we'll reach out to you if you're one of those individuals. And like I said, we will share questions and answers with everyone, so you all get that information. One topic that has come up that I wanted to talk about a little bit is about technology to assist clients in actually doing these, right? Because these flexibilities, these waivers are really great ways to keep everyone safe, but your actual clients, the individuals you're assisting, need to be able to connect to do that. So first of all, if you do need to purchase any equipment so that clients can do these things virtually, whether that's a tablet, whether that's a cell phone, because not every household has access to that, those are allowable costs under the HOPWA program. As I mentioned earlier, please make sure if you're a project sponsor, you are connecting with your grantee before spending any funds, because you'll want to make sure that you're allocating those costs correctly across the correct HOPWA activities and any non-HOPWA sources. But you can purchase and loan devices for clients, whether that's to help them with doing a virtual a virtual annual assessment, to have virtual case management contact, even to do an inspection. Those are all things that you can do, and the client just needs to return those devices to the HOPWA program when they are finished with them, because they are the property of the HOPWA program. We are also aware that there are going to be individuals and households out there that just aren't tech savvy, that may not be able to operate some of this software or hardware even if you provide it, which is completely understandable, which is why you want to think through different ways to do some of this, right? Which is why we've talked about different methods, for inspections. We've talked about, doing it virtually or doing videos or doing pictures. So that way you can be in communication with a client and see what ways they might be comfortable with. I've also spoken with some communities who are trying to be very mindful and thoughtful and creative in how they solve this. So in some situations, it might involve doing part of the HOPWA paperwork or a HOPWA annual, or even part of the inspection with the client alone on, say, like a telephone, but maybe that individual has a friend or maybe an additional, person who lives in their building that can assist them with the rest. And so that's not for everyone, right? Because it's all going to be up to the client what they're comfortable with. But I am aware of programs that have sort of talked to clients and say, let's get all the sensitive information out of the way, right? Anything that might tip anyone off to why you are connecting with me or getting assistance. And if you're comfortable and you just want to get the inspection out of the way, right, is there anyone in the building that could help operate the tablet for you, who might have a smartphone that we can connect with, right? And we'll use our pseudonym name. They don't need to know the specifics of why we're doing this, but that way we can get it done, right? So we really encourage you all, because if there's one thing that I've noticed for the HOPWA program is you all are very creative, thoughtful, and resilient people in programs. So keep applying that creativity and resilience in what you're doing and just problem solve through this. And as you've heard me say, if you have questions about if something you're doing is allowable, reach out to your grantee and ask. That way they can help you think through any problems that might pop up, particularly in situations that clients don't know how to navigate some of this new hardware or software.
Sorry, Steve, I wanted to mention one question too that was posed, that clients too could, like say you're working with a client and you need them to sign something like a release, that can be done like remotely, like over the phone, a intent to sign or permission. Can you talk about that a little bit?
Yeah, can you just ask that again?
Yeah, sure. It was actually our lovely colleague who asked if a client could agree to consent, right? Agree
over the
that,
phone.
yeah, Correct.
Yeah, sorry. So as I mentioned, right, the one thing that makes webinars like about remote methods fascinating to do is there are always technology glitches. So I don't know about all of you, but this is currently one of those days that everyone's at home. So we have people working from home, people teaching from home, and people learning from home today. So our internet's a little glitchy at moments, and I'm sure you've all experienced that. So thank you for repeating that, Heather. Just cut out for a moment. Of course, a client can verbally consent over the telephone. This was something when I worked for an aid service organization, we would do all of the time, have a client consent over the phone. Our particular organization, we required if it was a telephone release of information and someone consented, we would have a witness. If we could, we would write on the release of information that it was done over the phone. That way it was clear that we weren't forging a client's signature. And as part of our requirement is we would follow back up with the client when we met them in person, right? So if we were going to end up meeting the client for either case management or an inspection, we would take those to be signed. In some instances, because we served a large geographical area, we might send that release via the mail to try to get the physical signature. But at least we had the client consent verbally over the phone so we can continue our work and not need to delay it.
Great, thank you. There's also a question too. Is there a form available that a client or a household can use to self-certify income? And even beyond that, self-certify HIV status? And yes, yes, there is.
Please, Heather, go ahead.
There is on the HUD Exchange, and I think, right, it's the HOPWA Administrator's Toolkit, there is a self-certification of income form that could be used to, self-certify that you have an income source. Also located there on the HUD Exchange is a zero income affidavit, right? That can be used to verify that you don't have any income. There is a statement of HIV form on the HUD Exchange, but I think the original intent of that form was, that form would be, provided to, a medical provider, right, to fill out and sign. So if you could possibly absolutely adapt that form to use so a client could then, self-certify their HIV status. Anything to add?
I would add, particularly looking at some of those forms and adapting them, particularly if you're going to apply self-certification to rent calculations, because you'll want to make sure that you're asking clients all of the relevant questions that you sort of just subconsciously think of, right? That if someone's working, what's their gross income versus their net income? What deductions are on a pay stub that might affect other mandatory deductions? So having some sort of adapted form that you use universally across your program would be really key to make sure that you're accurately getting the information you need so that if income verification does come in or at their next annual, there's not potential wild swings of income because maybe you forgot to ask about net income or any deductions that might occur.
Okay. Did you address the question about if for annual inspections, if virtual inspections are occurring, does somebody need to go back and do a physical inspection once it's been deemed safe to do so?
As of this moment, if you are doing the virtual inspection, there is no requirement to do an in-person habitability or HQS. There is a requirement that if lead-based paint is an issue, and so you've done a visual assessment, that you do go back in and at least do that once it's safe. You may choose to go back in and do in-person physical inspections, particularly if there is something that you are worried about or questionable about, because you would rather catch that early than have to wait and potentially get worse. But at least if you're doing all your due diligence and don't have to worry about lead-based paint, no. I wanted to back up for a second because there's some additional questions coming in about releases of information. And so
Yes,
I just want to make sure to be,
I was just
yeah,
gonna go to do that.
yeah, I was afraid of forgetting. So we just want to be very clear, right, that while you do have flexibility in how you get that release of information, including, right, maybe over the phone, you should not have one blanket release of information for the
Right.
entire program, right? So you shouldn't have one release in a file that you leave blank and you just photocopy and apply to every situation. You should be getting client consent for every different entity that you're connecting with. So that client is aware that you're going to be discussing them and potentially sensitive information with whomever that person is. And because particularly then the client might have the ability to limit some of that information shared, right? Because what you share with a doctor on a release of information is probably going to be radically different than what you share with a landlord. So, right, so just to be clear, right, you have a lot of flexibility in how you get that release signed or verified, but you still have the same idea that you need a different release of information for every situation that's going to occur.
Right. And your release should spell that out, right? Released, released from and to, obtained from and released to, and a description of what it is you're requesting, right? And it's not even just the client, it's any adult household member, right? That you're getting information about. So you need to have releases for everybody, and they need to be updated annually. You may not need one release that you had the previous year, the next year, because maybe their job is different, right? Or maybe something else is different, but you would need a new release. We have seen, these blanket releases with all these organizations and everything listed. But yeah, you definitely need individual and descriptive releases. Let me say, if we certify income and a client needs help more than once during the year, do we need to requalify income for each application, or is this for 1 year? This seems to me like this might be, for instance, I'll take TBRA and then you can talk about STRMU. Okay, for say TBRA, for example, right? Say first of all, you're determining income eligibility for HOPWA in general, right? So you're going to determine their income level for HOPWA initially, right? And so say then you're going to be working with them for tenant-based rental assistance. So you did the initial determination of income eligibility, and then at the annual, 1 year later, right, for TBRA, you're going to be recertifying their income for continued income eligibility. But when we're talking about TBRA, you're certifying income for the income eligibility, but also as part of doing a rent calculation. So you want to talk about certifying income for STRMU?
Yeah, so
Yes.
a lot of what Heather said applied. Sorry, just sometimes need to shut the.
Now you're on the right of me. Before you were on the left of me. My left.
Right, so a lot of what Heather said is going to apply to the STRMU program because you do need to determine income eligibility for HOPWA as a whole. But because you're not doing a rent calculation, right, you're really looking at verifying income as a client might need assistance, right? Because once they're coming through the door for initial assistance, you could determine STRMU eligibility. And then from there, you really only need to worry about documenting income if there's some other change that might affect their STRMU eligibility, or if you're a program that asks households to share in the expense. So if someone might have something that might change that, right? How much they should pay towards rent or mortgage or utilities, you might ask for that, but that's not a requirement for HOPWA eligibility. That's going to be basing it on need. But then you could still go through all of the waivers and flexibilities that are offered, so you don't have hard documentation requirements and not able to help people when needed.
Okay, there's a question. Some of these, and as Steve mentioned before, some of the questions that you're posing, they could seem like, straightforward questions, but when we read them, we can see some nuances in them. So, we do apologize, but we're not going to answer them, in this format. But we will absolutely, get to those and, follow up offline and make sure everybody, is able to see a response, because there's some really good questions, about what happens when somebody claims zero income and then you find out later they have income. That's, kind of complicated to get into in this situation. But believe me, we completely understand what you're referring to. And that's an important question. So we definitely want to give that some thought before we respond. There was a question, I apologize. It was, about housing assessments. Are those, what was the question? Something like, do conducting a housing assessment fall like the same for the housing stability assessment, fall like in the same thing as the waivers, like the inspection? That doesn't really give you a lot to go on, Steve, does it?
No. Right, but I mean, and in general, right, any assessment that you're going to do, just be mindful. I mean, I think one thing that's very aware from the TA work that we've done and the webinars and these questions is you all are very thoughtful and you all want to do things to the benefit of families living with HIV/AIDS. Right, so if you do have any assessment forms, any applications, any standard forms, it doesn't mean you don't have to not use those because of the pandemic. It just means be flexible on how you apply those, right? So that therefore a form, because there are no requirements for what those forms look like or say, that a form doesn't become a barrier. So a household might not be able to exit homelessness quickly, or might become homeless because of a standard form or a standard assessment.
So the question is the housing stability assessment, or does it fall in the same category of inspections as far as waivers need? So your housing stability assessment should occur like it's always been occurring, right? You don't, if I'm understanding the question correctly, like Steve was talking about, you can do that remotely. You don't need to meet face to face with a client to do a housing stability assessment. So whatever your process or policy is, right, your grantee, the project sponsor, for conducting, as part of case management, a housing stability assessment, I think in most instances that could occur, at the same regularity as it was before, maybe a little bit differently, but it might just be that you're doing it remotely and over the phone versus face to face and as an in-person appointment or meeting.
Yeah.
Does that make sense, Steve?
Yeah, I think that's spot on. So these questions are great, everyone. Like I said, there's some really good ones I wish we had time to get to, but I want to be mindful of time because you all have welcomed us into your world for over an hour. And so we have a few more slides that we want to get to. But yet again, we will remind people, right, any questions we didn't get to, we will definitely address offline, and we will put together a list of questions and answers and make sure that's shared with everyone, those who are here as well as those who are unable to make today's webinar. So you will have the same information.
Yes.
With that, Zanab, do you want to go to the next slide?
Okay, so, and I'll just stay on camera now at this point. So what's next? So after the office hours, everybody is going to receive a HOPWA CARES Act survey. It's going to ask some questions about, is there any information that you would like about the HOPWA program, and administering and providing HOPWA supportive services and housing assistance, any resources, tools. We also too wanted to mention an amazing tool that was recently created by some of our TA partners. HOPWA guidance for COVID-19. It's a recently published tool for policy development for grantees that are developing policies around, CARES Act funding and using waivers. And both of these links are live. So once you get this presentation, or if you select the little title here that says handouts, you click that, there'll be a PDF version, and you should be able to save that to your desktop and then print that out. Next slide. And these are just some reminders, folks that have been present during some of our other webinars. We've included these, last slides in every presentation. And I'm just going to read the title. Just make sure that you're applying HUD guidance to the correct program, right? There is, lots of changing information coming out, lots of flexibilities and waivers for different HUD funded programs, such as COC, ESG, Public and Indian Housing Programs, CDBG, Community Development Block Grant. COC means Continuum of Care. ESG means Emergency Solutions Grant. Sorry again for the acronyms. Make sure you're applying the right program guidance and the right waivers to your HOPWA program. Grantees are responsible for notifying HUD of their intent to use the waivers and for developing new policies and procedures. Those policies and procedures should also trickle or be carried over to your project sponsors. So project sponsors who are on the call, make sure you're talking to your grantees, you're talking to each other and updating policies accordingly. And stay tuned for lots of new guidance that is still forthcoming. Make sure you're signed up for the HOPWA listserv, and also visit the HOPWA landing page for information about COVID-19 and housing and urban development, community planning and development HOPWA landing page. Next slide. Also, coming attractions, stay tuned. Wednesday, December 9th, 2020, 2 to 3:30 p.m. Eastern Time, the next HOPWA office hours will occur, and this one is about supportive services. Please join. Next slide. And there's technical assistance available, right? So grantees can submit a request for TA, individualized TA related to responding to COVID-19, as well as regular HOPWA program administration and requirements. There's information here on the slide about where and how to submit a request for TA. Next slide. And here we have some additional resources. When you have some time, take some time to select each of these links. There was a question earlier on about the waivers and where they were. These are live links right here on this slide. The first mega waiver, April 2020, and then the second one a month later, May 2020. Next slide. And also we have the HOPWA Ask a Question desk. So if you have a question about the HOPWA program, HOPWA notice, waivers, implementing COVID-19 activities, it's not only about CARES Act and not only about COVID-19, but generally HOPWA program administration requirements. We'd love to hear from you. So please submit your question to the HOPWA Ask a Question desk. And that link will take you to the portal where you can submit your question and just follow the instructions on the page. Next slide. That might be it. Oh, the last one, stay informed. Like I said, Make sure you're signed up for the HOPWA listserv, the mailing list. Here's a link right here with instructions on how to subscribe to the listserv, and also a live link on where you can get updated information about HOPWA guidance for COVID-19.
Final slide, please.
And that wraps up today's
So,
office hours.
thank you everyone again for letting us into your hectic, crazy, busy lives for 90 minutes. We really appreciate the time that you give us and also the great work that you all do. So we'll be emailing this presentation out. And so please make sure to follow those links and reach out through the Ask a Question or the TA portal if you do need any additional assistance. We're here to help you however we can.
Thank you very much, and we apologize for the audio issues in the beginning, but yes, the presentation was being recorded, and we'll make sure that that's available to everybody as soon as possible, as well as we'll provide responses to the unanswered questions, and there'll be information available about the answered questions also. And now we have Rita and Amy from our wonderful HUD OHH staff.
Thanks, everyone.
Thank you, everybody.
Everyone. Have a good day.
Have a great day. Thank you.